In our studio, Dr. Joe Congeni, Sports Medicine Center, Akron Children's Hospital, kind enough to join us an in-studio visit. And you want to go to the thumb, huh?
Yeah, let's go to the thumb. Not necessarily the J.R. Smith thumb, but the thumb injury I want to talk about today is one that's very common in high school athletes. So we deal with it year-round in high school. Basketball, quite a bit. Football, quite a bit. It's treated a little bit differently, as are a lot of things, than sometimes in the professional setting. So in the professional setting, we see somebody like Chris Paul. Initially, he jams his thumb, they say, right? They say the x-ray's normal, so the Clipper fans are happy about that. The next day, they say he's going for further testing. MRI shows a torn ligament. The next day, they're talking he's out 6 to 8 weeks with surgery on the thumb. This happened to us in Cleveland sport before, too. You know, in the history of Cleveland sport that I wrote up in my book, in 2010, there was a big guy hanging out right around where we are here in Fairlawn a lot. He was going to some of the restaurants and eateries, and a very large man by the name of Shaq. He came in to help us win a title. You remember that?
I do.
And on February 25th of 2010, Shaq tore the ligament in his thumb as the team was trying to come together to get ready for a big playoff run. Maybe the final turned out to be the final playoff run, first time around for LeBron. He came back 6 or 8 weeks later. It was around the first round of the playoffs. He didn't fit in when he came back. The whole thing didn't work. The team went downhill, obviously, and it was a major problem. So, in high school kids, we see this injury a lot. And what happens is the thumb gets bent backwards. They tear the ligament down at the base of the thumb. The x-ray can be totally normal. And in most cases it is. There's no fracture with this. But with the torn ligament, it takes a while to heal. And sometimes it doesn't heal quite as strong. But in most high school kids, what we do if there's a partial tear is we put them in a cast or we put them in a splint that won't let that thumb move, and the ligament heals most of the time. In professional athletes, they don't like most of the time. They go right off to getting an MRI, very fancy, expensive test, fixing it with surgery, and then say in 6 to 8 weeks they know what they're going to get when they get back. Versus in high school kids, most of the time kids will get well when we cast them, splint them, go on to taping them, and they're back playing for us in 6, 8, 10 weeks.
Now, do they get lingering effects from an injury like this?
Sometimes they have a little bit of extra looseness in the thumb, and they may wear tape for 3 months, 6 months after they have an injury like that because it feels a little bit loose in the base of the thumb. Sometimes it doesn't heal all the way because muscle interposes, gets between the healing ligament, and then you get to the end of the road and you say, hey, we need to do surgery again. Nobody takes that chance in the professional ranks of somebody like a Chris Paul or a Shaq O'Neal.
Mm-hmm. With us in studio, Dr. Joe Congeni, Sports Medicine Center at Akron Children's Hospital. Obviously, this is an injury that can cover all sports as well. I mean, from football to basketball to wrestling.
Yeah, it occurs in all of those.
Yeah.
And it actually got its name 20 or 30 years ago. They changed it from gamekeeper thumb to skier's thumb because the ski pole would hyperextend the thumb when people were skiing and they hit hit the ground with the pole, their ski pole, and it would hyperextend the thumb and cause them to tear this ligament again as well. So very common in skiing, too.
A lot of times we can do some preventative things, but really with this, you really can't, can you? There's no padding or anything.
No, there really isn't padding or anything. I mean, making sure that you keep the muscles of the hand strong. And in fact, when kids with the thumb injury get to week 4, 5, 6, 7, they start doing strengthening just like you would if you tore a ligament in your knee or tore a ligament in your ankle, a strengthening program to prevent it from coming back. For skier's thumb, for a ulnar collateral ligament injury, if you use our vernacular, our terminology of a thumb, getting them stronger again when they get back to sports so they don't have it happen to them again.
And Joe opened up, folks, by saying this isn't J.R. Smith. J.R. actually has a fracture in the base of the thumb,
yes,
right?
And I feel bad because the very first day you and I were together in here and talked about the fact they reported that his x-ray was questionable or didn't show a definitive fracture, and then they came back and said, no, it's a very unstable type fracture that needs to be fixed and even takes longer than fixing that ligament. Fixing the unstable fracture down around the base of the thumb takes more like 10 to 12 weeks. So JR, even though that was earlier in the season, it's looking like it's going to be just before playoff time when he comes back.
Dr. Joe Congeni with us in studio.